What is anxiety, comorbidity, and epilepsy? Imagine living with epilepsy and feeling anxious at the same time. That's what we call anxiety, comorbidity, and epilepsy. It means many people with epilepsy also experience significant anxiety, which can make managing their condition more challenging. Anxiety disorders are very common in people with epilepsy, second only to depression. Studies show that between 11 and 25% of people with epilepsy suffer from anxiety disorders. Some reports suggest even higher rates, especially among teenagers and adults. These anxiety issues can include generalized anxiety disorder, social anxiety, panic attacks, or specific phobias. The connection between epilepsy and anxiety is complex and goes both ways. Having epilepsy can increase the risk of developing anxiety disorders. But anxiety itself can also influence how well epilepsy is controlled. For example, feeling anxious can sometimes make seizures more frequent or harder to manage. Anxiety may also reduce how well medications work or affect responses to treatments like surgery. Often, anxiety occurs alongside depression in people with epilepsy, adding to their emotional burden. When anxiety is present alongside epilepsy, it can seriously affect quality of life. It might cause emotional distress, lead to social withdrawal, and make it harder to stick with treatment plans. This can increase the risk of feeling isolated or even contemplating self-harm. That's why early recognition and diagnosis are so important. Healthcare providers often use screening tools like the Generalized Anxiety Disorder 7-item scale or the Hospital Anxiety and Depression Scale to identify anxiety symptoms. Several factors can increase the risk of anxiety in people with epilepsy. These include the number and type of seizures, the medications used, and whether depression is also present. Socioeconomic factors like lower income can also play a role. Anxiety symptoms may appear at the time of diagnosis or develop later, and they can fluctuate over time. Sometimes, managing epilepsy effectively can help reduce anxiety symptoms. Treating anxiety in people with epilepsy usually involves a team approach. This might include psychological therapies such as cognitive behavioral therapy, which helps change negative thought patterns. Medications can also be used carefully, with attention to how they might interact with epilepsy treatments. It is essential to address both conditions together because doing so can improve overall health and quality of life. In summary, anxiety, comorbidity, and epilepsy is quite common and can significantly impact seizure control and emotional well-being. Recognizing and treating anxiety alongside epilepsy is a key part of comprehensive care. If you or someone you know is experiencing these symptoms, it's important to consult healthcare professionals for personalized advice and support.